She did. Yeah, love it. Okay, right.
Good
Start all
work,
that again
Kelly.
then, Chris, you numpty. All right, let's just quickly go through the SI joint movement again, just so we got. Hello, Hayley. Good evening.
Hi.
How you doing? Nice to see you.
Yeah, good, thank you.
Just go through that Gilliatt's test again, just quickly. So let's do left side. We're just going up. No, sorry, Kelly, the other one. So come up and then back down again, and then one more time. Yeah, and then we'll come over to the other side. Oh dear. Last week I didn't press the wrong button completely and nobody saw the program at all. This week I've forgotten to press the feedback. Yeah, it's not looking good, Mark. It's not looking good. My technical knowledge is... Anyway, right. I'm going to ask Kelly just to bend forward again. We've already done this, but got a better sense of spine eye group. This one still stands out a bit, but this far more balanced generally. When I spoke to, and come back up again, thanks, Holly. When I spoke to Kelly a bit earlier, just about feedback on where she is, I mean, generally, I think she felt that there was less pain on her left side, less tight, and the pain of swimming is less. It's still there. I think that would be, is that a reasonable summary? So if you come and lay on your back for us, and I just want to see what the range of movement of lats is and stuff like that. So I'm just going to pop this on you. So now we'll move this round so we can give other people in the room a bit of privacy. So not everybody needs to see everything. So here we go. There you go. Right, I'm just gonna see what yeah, still it's interesting, isn't it? It's kind of stubbornly doesn't want to move, does it? You know, it's one of these kind of been there a long time and trying to unpeel it. It does look better, but not right. Still, we got the right shoulder protracted. Not a lot, actually. But it's still pulling up on that right shoulder. A couple of things I want to do when I was thinking about doing this treatment. I mentioned to Kelly when she came, when we got to, you know, when she arrived. See, better. Do you think better? You know, not as fixed and as nasty on the left as it has been. I'm going to quickly do a bit of work on this pec. To work on both pec minors. Let's just see what. Does anybody want to sort of add anything? Yeah, pec major, yeah. And this one. Anybody want to throw in any Pennisworths? That's, yeah. What do you think, people? Now, whatever you do, you mustn't all talk at once. It gets overwhelming.
Come on, Hayley, you can jump in.
Come on, Hayley, where would you start?
Come on, Mark, you go.
Pop your arms. Yeah, thanks. Interesting when you get these kind of cases where things just feel quite stubborn, and you could almost think that you're not making any difference. You know, I could almost feel that this is the third time I've seen Kelly and I'm sorry for wasting her time. You know, that kind of feeling where you're kind of doing something, but it's.
How many more treatments would you do?
Yeah.
Are you seeing enough of a change from week to week to continue the treatments?
Sorry, say that again, Mark.
Enough of a change every week to continue doing treatments? Because usually you say after 3 treatments there should be some difference.
Yeah, no, I agree. I think interestingly here, yeah. Well, I suppose the truth is that there is some difference. you know, we're not in the same acuteness as we were, and maybe I'm kind of, I suppose the bit that's going on here in the background is I don't know what Kelly's doing in between treatments, other than I know that she's working, and I guess that involves doing her swimming. Yeah, so it's not like she's able to give it much time to really kind of get better. Does that make sense?
Yeah, but then so you're seeing differences and changes from week to week. Would you continue doing a few more treatments, like say you know, another couple of weeks, or just continue keep going every week until there's real significant difference and there's almost everything has been resolved?
I'm going to hold that question until I've done a bit more kind of work with Kelly this evening. I want to feel what her back feels like a bit more, and get a sense of her lats, and just get a bit more of a feel of what's going on. But it's a really good question. I think, do we carry on? Well, I think we probably do, but it's about how we go about doing that. And I'm going to do more of that sideline. I just want to pick out this peg a bit more. Let me just knock that round. There. Okay. Bring your elbow into my hand. And then relax, take a breath in. Is that all right? Too much? Or? And then push into it. And then relax. Okay. So breath in and breath out. How are you getting on, Hayley? What's news?
Yeah, not too bad, thank you. Pretty good. Things are starting to finally take some shape now, which is really good.
Nice to hear.
Yeah.
Nice to hear. Deltoid not as strong on this side, is it? You can feel the tightness of the deltoid on the other one. Okay, then. Yeah. Interesting, isn't it? Just how we start to get this shift and change in the tissue here. So subclavius dropping in underneath that clavicle, just lifting the arm up, stretching, getting there. Actually feels okay. Let's just compare that to the other side. How does this one compare to this one? A lot more pain on the left. Yeah, interesting. You hardly feel it, doesn't it? Fascinating, isn't it? It's really interesting how the pain pattern shifts from side to side. Yeah, nothing here, is there? It's sort of clear, isn't it? And it feels not. Yeah. Try and how's that feel with the camera? You can get one side, can't you? To get the neck treatment in. A good camera shot. It's quite hard. Just going to run down that lamina grooves a little. It feels better here, doesn't it? It does feel better. You know, it's interesting, Mark, isn't it? You know, I was thinking about your question of, do we go on? How many more treatments do we think about? How do we manage that? What's the fair thing to do to the client? And then when you get hands on, you start to feel some of the tissue. This feels very different than it did sort of 2 weeks ago. And in, you know, I don't know, if we added up the hours that Kelly's been kind of swimming, I don't know, competitively, let's use that word, we'd come up with several thousand hours, and add up how long she's had this as a theme that's niggled in the background, we'd come up with another few hundred hours. And then we're expecting 3 hours to change it. And we're thinking, oh, well, that should be all right then. So in 3 or 4 hours, we should be able to undo several hundred hours. Just, you know what I mean? And I think it's really interesting how we kind of get our heads around that and how we make sense of that.
No, I understand. I see what you're saying.
Yeah, and it's more, I think the discussion is more about how do we talk to the clients about this so we don't feel that we're defrauding them or something, or doing something, we're kind of, we're trying to get away with something.
Yeah.
That's all. Is it so? Is it? I'm busy talking to you, Mark, and I'm paying no attention to my client at all. I put my fingers in and she glares at me in this kind of, yeah, really? Is it sore? Just a bit. Nice one. Excellent, Chris. Great. Client care, always been my strong point. It's really interesting when I spent all my day, my days of sort of judging eye contact now. I've given up with mouths. It doesn't seem to work because they're always covered up. So now it's all about communication with eyes only. So it's quite fun. And sometimes you get it completely, completely wrong. Do kids you work with, do they wear masks as well? So everybody wears masks.
It's that greeting, I feel now that I tell people that I am smiling. Because they can't tell.
Oh, your eyes smile. You're fine. you're yeah. But you're right though, isn't it? It's a funny world we live in. So really just trying to stretch out a little bit of upper trap on the left side without kind of going to town, just to sort of say hello to that a bit. a little bit on this side too, I guess. Although no, there's much in that, is there? Nowhere near as, you know, remember when we first had Kelly on the couch and I got hold of upper trap and pinched it, you know, that kind of, you know, she was quite clearly, you know, left side was pretty nasty. And when I come up around the occiput, around the kind of right around the top there, those small hip head kind of extensors right up in the gully at the top by the occiput, you know, they were pretty horrible, but they don't feel too horrible now. They feel better. Okay, I want to smash this one out a bit quicker than normal because I think it will be good to spend more time looking at these left lats. So let's turn you on your right side and I'll give you a pillow and some couch cover on there. So I slide down the couch a little bit, Kelly, if you can, great. And let me just pop that little bit of couch cover on there. And I'm gonna just pull that a little bit like this because I want to get a good camera angle. Should we move that out of the way completely? Yeah, sorry. Oh. Lower hand just on your breast tissue there, please. And then I'll do the bra here. Come down. Right. How does that? I've got a little windy wheel on my tripod, which is so cool. I feel like I'm a proper little cameraman. It's brilliant. And you twiddle it and it goes up and down. I could do this as well. I'm in the wrong job, Mark. There's no question about it. Right.
Yeah,
okay.
maybe your talents lie elsewhere.
You are? Oh, dear. I think I'm starting to go.
Maybe your talents lie elsewhere.
You maybe what?
Your talents lie elsewhere.
Yeah, me. Yeah, I'm not sure. maybe. Okay, how's that look in terms of camera? I think that's okay. We'll have a little play and just see how we get on. How does that look? Does that give you a reasonable viewpoint? You're looking at me.
Yeah,
really.
that looks good.
Yeah, let's just drop you over there and just see if we can do that angle. I think that might be better. I don't want you just to do me. Is that better? Yeah. So I really want to work on lats. And I want to kind of just really soften up this whole left side here. Spine eye particularly. But I want to kind of come on that deltoid here as well. Infraspinatus. And really just clear through here and just see what we can tidy up today. Dear. Just broke the cable to the pacemaker. Okay, so let's just bring that arm over the top. Okay, just let that relax there. How does that feel, Kenny? Sore or not really? No. So just looking at QL here, really.
And then he had plenty of water, a couple of litres of water.
Okay. So, not really. Yeah. It's okay.
Purely from sitting at home in less good posture than I would be like this as I'm working at the laptop. And I feel it kind of also on this wrong side, not there.
Yeah. Just a little bit too slippy. I want a bit more of a grip on the sort of lateral edge of the scapular tricep. It's better.
It's a neck, isn't it? So if you just want rotate the neck to the right. Yeah. So it's coming down onto the shoulder. And then if you just go to the other side. No. So it's coming down this.
But when I'm going that way, it really hurts to be there.
It's all here, isn't it?
Just drop that camera just a little bit into that position. I just want to hold of Kelly's arm here and give it a bit of a pull through. And just get some.
We did it, but I think when he started off, yeah.
It's all right.
So just put my hand behind the back of the head again then. Just going to open up pec minor. So just, oops, jiggle around a little bit, just drop in there with the camera. So coming back down into here. And then coming behind, just let the arm relax on my arm. Coming under his pec major. Coming up under our pec major, holding the top of the scapula and coming up. And then sitting back on the ribs. Having a bit of a play with last time I did this, Kelly sort of screamed accordingly, and it's all okay. And Not at all?
Check my
No.
right back, which
I just can't find the kind process a little bit in here. Okay, and then drop on.
Chris, are you working on pec major there, or are you working on subscapularis?
No, I'm working on pec minor. Let me just get the camera in a better place and you can see where I'm coming. Nothing like a close-up of your pec major. Let's try that position, Mark. So coming up through here.
Oh, no, on the front side, sorry.
So here's pec major. Yeah. And I'm coming underneath it. I still can't see very well. Let's just drop on. Does that feel there you see, look, here's pec major. Yeah, and I'm coming up underneath, holding top of the scapula, coming up in through here, sitting back on the rib cage.
Okay.
And then I'm relaxing on my arm. Okay. That's it. And then I'm dropping up and dropping into here. So take a breath in, let your shoulder drop. I'm going to just drop into a little bit of MET on that straight away, holding onto the rib cage this way. Okay. Around the back here. Can you pull towards my fingers? Yep. And then relax, take a breath in. Yeah. And then I'm going to follow that straight up with MET on the pec major. So putting the scapula back where it belongs, this move that we do a lot here, that whole opening up. Okay, just push into my fingers, just a bit of a firing of pec major. And then relax. And again. And relax. Okay. And then relax back down here. Come back round. Oops. Come on, Mr. Camera, you're supposed to focus automatically. Looks like we're in a dark room now, doesn't it? Come on. See? Bit of effort. Horizontal adduct. So just really targeting those triceps. Which I think are a contributor to the pain coming out the water doing the crawl. It feels okay actually, Kelly, isn't it? You're not discomfort? I don't think you are, right? Yeah, feel it through your tricep. It's tended, the bottom part of that in there is nasty. And that means we'll do a bit more of that then. That's all.
It's all about
Just okay. So pulling the arm down slightly with my left arm and then coming through up a trap.
You could go even harder, probably about 2.
Bit nasty, but
Sorry, when you did that.
Yeah.
That's
Sweeping it.
yeah.
so. So whenever I work in this kind of quadrant here, I think about what's here. Coracoid brachialis comes through here, short arm of the bicep comes through here, pec major comes through here, and separating them out in detail is quite tricky with the arm being in a kind of, in all its different places here. I find it a bit tricky, but I think you can generally, coming in the inside of bicep, coracoid brachialis sits in here, doesn't feel very happy. So I'm coming through and just feeling my way along it as it disappears underneath the trap. The deltoid. And just trying to sort of feel my way. And then when I sit on something that feels a bit angry looking, I think, right, okay, let's just trigger point that a bit and release and get Kelly to relax on it a bit. Are you comfortable there? She's rolled a bit on her side, but I don't mind so much. I think that's okay, really, as long as it's not uncomfortable for it. In fact, you're giving the lats a bit of a stretch doing that, so which isn't such a bad thing. So, anterior deltoid, key player here. Keep nibbling away at it. It feels nicer now. Coming down onto the chest plate there, obviously as well. So you can see you've got a lovely view of my elbow. Yeah, that's better. So I'm sort of doing this kind of moving, sliding through that pec as much as I can through here. And then I'm going to just stretch it out a bit, coming down onto the chest a bit. Okay, come back up onto his side. Maybe just bring it back forward just a little bit, Kelly. Brilliant. Thank you. And then so now I'm going to move Kelly right round so I can get her laying on her tummy. Are you okay like that? Yeah, could you wriggle through and come down onto you? Perfect. Thank you. You okay? Just okay. What do I do? I'll move the camera over there. You okay? You happy? You're a star. How's that? We can say hello to somebody else. Somebody's come in. Somebody's come in, Joe. Would you go and do the hospitality thing? So I suppose the main differences I've done today really is focused on. Sorry, did you say something? Really focused on lats a bit more, and tricep and coracoid brachialis. The difference between that one, Joe, that one there, Kelly, and that one. Not much? Yeah, not much, is it? Yep. How exciting. Some people wait months and months, a whole lifetime to get a skeleton delivered. Okay. I've grind to a halt, Mark. I don't know what to do next. I can't decide what to do.
Where do you feel drawn to?
Well, I've got to let you into a small secret in that before we started the conversation, Kelly was talking about when she stood up, her right leg turned out. And it made me think about her adductors. And I was kind of finding myself thinking about the medial sort of central line through here. And I kind of just, don't know, I find myself wanting to think about that. I don't know. I'm going to just see what range of movement is like for quads, which is excellent. Quick look at piriformis. Excellent. So I don't know what to do now. It's not good, is it? Just feels all rather sort of all right, really. No one side more than the other, is there? What do you think? Yeah. So you're thinking left glute? Yeah. Let's have a go at left glute then, shall we? You happy with that? I'll have to pop your shorts down. Are you able to? Shall I do them or? Yeah, I'll do them. All right from there. Just move. So move the camera a little bit there. So got a little bit of a clue on what I'm doing here. Yep, cool. So line of piriformis. Yeah, sore, but not really. More glute med, I think, more in here. Yeah. So more glute med being a kind of a lively thing. So PSIS is here, iliac crest, sort of where roughly around here is glute med, sore. So just sitting on glute med there. Is that okay? Let's just check the line as the sacrum. I think is always a good indicator to play with for a few minutes before we finish. How's that? Not too bad, is it? So direct trigger point on top of glute med, supported thumbs. You know, I guess if you're working on glute med, you're going to be definition this low round by the ilium. You're going to be working our way through to some of glute med. And it's interesting just picking up your point that you said, Mark, about what am I drawn to. Interesting. Sort of Kelly says, yeah, my glute somewhere, or you know, left sort of medial rotation or something. You know, then that would really interesting about where you begin to sort of find myself drawing a bit more. Shoulder here seems to be reasonably stable for me now. You know, doesn't feel like there's massive imbalances anymore. So now I'm drawn more to the pelvis, and you know what's actually happening here, and maybe more assessment of Faber test, you know, TFL, what's going on with the perineals, hamstrings in detail. You know, is there a bit of pulling going on medially, laterally with the hamstrings? That's maybe the next sort of journey, really. Next week to really think about. Let's take that another step forward. That feels nicer now, doesn't it? So I'm just going to do the other side, and then that. Yeah. Poor old Kelly. You're right. You only came along for a treatment, didn't you? So coccyx PSI. I'm just going to run along here because, you know, on the first treatment we came along the edge of the SI, SI joint, kind of edge of the sacrum, and it was really, really sticky and horrible the first time. And yeah, about there, wasn't it? And it's a bit angry there. You can feel that a bit.
Yeah.
Maybe not as bad as it was, or what do you think? Not, it's still there, isn't it? Okay. Intense, isn't it? Just do a bit more. Drop in and do glute med on this side. Not as sore as the other side. It is. So take a breath in for us, Kelly. And as you breathe out, just let your shoulders drop. Yeah. Can't quite see my thumbs there. If I take one of the thumb or hand away, you can see my fingers there. Being supported by the other hand. Pretty lively in there, actually, isn't it? Is it?
When you're doing that trigger point stuff, how does it feel in there? Does it just feel solid?
Yeah. What's it feel like? Good. you can, you know, all the other tissue or surrounding tissue feels kind of soft and squashy. And here it feels like you go through that soft and squashy, and then you end up in a place which is more fibrous. It has a spring to it, so it's not like shutting up. I'm not leaning on a door or a bone, so it's not a bone feeling. It's a squashiness, but a firmness.
Okay, all right. It just feels more firm and fibrous compared to the surrounding tissue.
Big time, big time. So if I roll around, then I can almost feel round the tightening tissue. Does that make sense? If I come up here and press in, don't feel it that way. Come below, push in, don't really feel it. Sit on here, yeah, okay, that's often, and that's very much a sort of a tendony area for glute min, you know, glute med. Feeling easier. It's being patient, isn't it? Of nibbling away, you know, being patient, allowing yourself to just keep nibbling with the belief that it will just slowly soften. And now it has. I come back down to it. It's still there. I can still feel the tendon of it, but not as intense.
Thank you.
Okay. I'm going to probably leave it there because I think I've done what I wanted to do tonight. We'll send Kelly home with stretches, more stretches to do on her pecs. Hey, look, you can see yourself on the screen, Mark. You can wave to yourself. It's quite scary, isn't it? Okay, so what have I done? I've tried to look at upper trap and neck, opening up those retraction of the shoulders, and then tried to think, well, let's have a look at this spine again, and get that lats, particularly on the left side, open and really kind of pulled through. And I think we'll review and we'll have a look next week and we'll see where we go. Any thoughts? So anybody's got any ideas? Anything you want to say? I've got to look at the screen now because I can't see. I could go this way. You can have a bit look at the room. Look, there's people walking around. There's all sorts of stuff going on. Any thoughts? Anything you want to say, Mark or Hayley? Any observations?
It was a really interesting case study, especially seeing it over 3 weeks as well, seeing where you start, where you move on to, and it's not like you don't go back to something. You don't just, okay, the first week you're doing the upper back and the shoulders, and then the following week you're moving down. You're kind of going back again, and you're retesting and you're looking. So you're going, working through the treatments, working through the different parts, but you're never kind of just completely ignoring one part after you've worked on it. you're always going back to it and checking it again, and that. So that was quite interesting to see.
Yeah, I agree. I agree. It is good.
I think so. I think tissue works well when we kind of have a nibble, do a stretch, move around, and then leave it, and then come back to it a few minutes later. You know, that model of going backwards and forwards is an interesting one to play with, and we keep talking about it. I kind of not sure. I need a bit of, and it's interesting, isn't it, when we see and we talk to them and we do our treatment. Actually, what's quite useful is to have a bit of time to think about it. And I've got an idea. I need a bit of time to think about it. I'm not sure. I think there's something pelvically going on, and I don't really know what. If there's some rotation or glutes might be the central to it. I think we're getting there. It feels like we're pulling it apart. The real challenge is that Kelly carries on working as hard as she does from week to week. There isn't a kind of period of slowing down or particularly taking her foot off the pedal. She demands quite a lot from her body every week and every day. And that gives us quite a challenge in terms of our treatment needs a period of time to get in. And I guess if I ask her what she's doing over the weekend, she'll say something like 1,000,000 miles or something. Is that true? No. Anyway, I'm going to say goodbye and leave it there, and we'll be back next week. I think if Kelly's up for that, you up for a session next week? So we'll be back next Thursday, and then maybe that's the time to really bring it together and decide, have we done it? What's happening? And go from there. Okay, I'll say cheerio.
Sounds good.
Bye.
Thanks, Chris. Thanks, Chris.
See you,
Thank you,
Mark.
Kelly.
Nice to see you both. Nice to see you, Hayley.
Yeah, and you
Go easy.
too.
All right, look after yourselves.
See
See you,
ya.
Hayley. Take care.
See you, Mark. Nice to see
Bye.
you.
Bye.
Nice to see you too.